The BBC this morning have released their findings of an undercover investigation into the supply of botulinum toxin prescriptions to beauticians, estheticians, other people in the UK without a face-to-face consultation. So in this case, they named this nurse, this pharmacist, and this person who pretends to be a doctor who isn't. Now, these people are providing prescriptions over WhatsApp, over text message, over the counter for cash without ever seeing the patient. And they're also adding additional toxin to the prescription so that other people can be treated as well. In some cases, they actually told the purchaser, the beautician, to make up fake records. In each case, they said they knew they should have a face-to-face consultation, but they wouldn't. So they're aware of it, and they know what they're doing is wrong, but they're still doing it anyway. What's the problem with that? Well, in the UK alone, in the last year, we had 2 big outbreaks in 2 different parts of the country of people who've been given imported toxins, which these people have been providing, and ended up on intensive care, ventilated. We've had deaths in the UK, 12 over the last few years, from the use of unlicensed toxins, and you are being put at risk. So if you're having a toxin injection and the person seeing you is not a clinical prescriber like a doctor, a dentist, a nurse prescriber, or a pharmacist, so in other words, a beautician or an esthetician, you should have had a face-to-face consultation with that clinician who's prescribing the Botox. If you haven't, you are at risk. It's as simple as that, because you've got no idea what's going into your face. So you must have had that face-to-face consultation. I would suggest you walk away if you haven't. Call out to the person who's giving it to you and whatever practice they're allowing. The government themselves should be regulating these healthcare practitioners. And here's the really distressing part of this story. When the Department of Health were contacted for comment, they refused an interview. That tells you everything you need to know. Don't put yourself at risk. Make sure you are seen by a prescriber when you have a toxin injection.